All right, a very good afternoon to all of you. Thank you for the kind introduction. So my talk is the start, and it's supposed to be talking about the current status in Ramadan education. So I'll just go on. So this is the outline of my talk. Okay, so I'm going to be talking about well, a bit of background. We all know about the Ramadan education, what's recommended by the guidelines. Then I'll cover a bit more about the Global 2022 with regards to the analysis for Ramadan education, some excerpts of it, and just summarize the takeaway points from there. So Ramadan education. So we are all well aware what Ramadan education is recommended by the guidelines. So you know that Ramadan focused education consists of the initial assessment 6 weeks prior to Ramadan at least, or even earlier in the cases where you need to optimize patients. Then we have Ramadan period where there needs to be support, and we have many studies that show telemonitoring support and how it can actually improve the complication rates during Ramadan period, as well as review post-Ramadan with regards to the challenges that were faced during Ramadan in order to review the kind of interventions that's necessary to ensure further good maintenance of good control after Ramadan, and also in the cases where there are further voluntary fasting outside of Ramadan period. So we are well aware of the key components of the Ramadan focused educational program. So I'm just reiterating the points here, which is first and foremost, we are well aware about the DAR risk stratification that has been recommended, the levels, as well as what are the recommendations based on the 3 levels of low, moderate, and high risk. So what are the religious exemptions? And how do we remove misconceptions? What are the common misconceptions? The need for blood glucose monitoring and frequency that's necessary based on the kind of treatment. You'll hear a lot more about that as we go on throughout this conference. The needs for fluids and dietary advice. And of course, the RMP that has been developed quite remarkably over a period of some years already. Data from various regions, physical activity and exercise advice, when to do it, and what is the relationship of our prayers with regards to exercise, medication adjustments, and test fasting, whilst optimizing to improve the glycemic control, and also, of course, when the patients decide to fast, when to break the fast, the recognition of hypo and hyper symptoms to ensure that patients are able to break fast when it necessitates during any acute complications. So let me go on to the DAR Global 2022 Ramadan education. Just going to cover a couple of areas that has been analyzed. So we are well aware the distribution of the DAR Global Survey 2020 to 2022, which involves these countries that's indicated here. The Gulf countries contributed about more than 2K, Middle East likewise, Middle East and Turkey, more than 2K. The Maghreb countries almost 2K at 1.8K, and the Indian subcontinent 3K, whereas Southeast Asia about 3K, and that actually contributes in total about 14,000 participants. And this is the data that we have with regards to the Ramadan education. So what we do know, though, is that out of all these patients, of all the participants, almost 60% received education, which also means that there is about 40% that needs a bit more effort for us to ensure that the proportions of those who do need education keeps increasing as our efforts continue. How about the demographics? In general, there's no difference between the 2 groups, those that receive and do not receive education. The mean age of this group that receive education is about 50 years. And with the gender distribution as shown here, 52% for females, and slightly less for males. Type 1 diabetes, about 15%. Type 2 diabetes, about 83%, almost 84%. and small number of 0.6% of gestational diabetes. The mean diabetes duration for this group was almost 10 years. The mean HbA1c was about 8%, mean BMI about 27.6, mean systolic blood pressure 127, of the diastolic 77, and mean LDL about 96 milligrams per deciliter, which translates about 2.5 millimoles per liter. So no difference between the group that received education versus the group that did not. So how about the baseline distribution of diabetes medication? In this group, we know that that's actually a large portion of patients on insulin. That's about 50% of them receive insulin, out of which about a quarter receive long-acting insulin. About same proportion receive short-acting. About half of that receiving combination, and pump about 1.6%. Sulfonylureas, about a third of this population. Of course, we know that most of the patients did receive metformin. That's about almost 2/3 of them. And quite a substantial portion, about almost 13%, receiving SGLT2 inhibitors. How about diabetes complications? With regards to the patients who receive and did not receive education, there were no difference apart from the group that had microalbuminuria and also the small group that did not have complications. These were the only two groups that have some significant difference. However, with regards to the rest of the comorbidities indicated here, there were no difference between both the group that received and did not receive any education. With regards to the sub-analysis for the different groups that receive Ramadan-focused education, we notice that the proportion is rather similar, with type 1 and type 2 diabetes both more or less about 60%. For the CKD group, type 1 as well, similarly about 60%. However, there's a slightly larger portion of the CKD type 2 patients who actually receive education, and similar proportion for the CVD patients as well as patients with type 2 on insulin. So how about the method of delivery? Well, we know that a large portion actually receive the education only during routine consultation. There's about 87.5%. A quarter only receive a leaflet, and about 10% receive group education. And really, even though we are doing a lot more online teaching and mobile applications, it's just a small portion out of the participants. It's about 7%. That will probably explain why, if you look at the duration of education, when it comes to the duration, a large portion actually receive education about 15 minutes or less, because most of them are actually getting the education during the routine consultation. Those that receive education for more than 30% is only a small portion, about 5.8%. And most actually receive about between 15 to 30 minutes of education. What is significant is that when we compare patients who receive education, Ramadan education, and those who did not receive Ramadan education, for the type 2 diabetes patient, hypoglycemia rate, the rate of patients who develop hypoglycemia, is actually much higher in those who are without Ramadan education, at 14%, 14.8%, almost 15%, when compared to those with Ramadan education. And this is a significant number to make us realize that we do need to work on the 40% of patients who are not receiving Ramadan education. And of course, if we think about the subgroups that was mentioned earlier, patients with various complications like CVD and CKD, they need to be better educated with regards to Ramadan-focused education. So this reiterates the point that Ramadan-focused education remains essential for safer fasting from the results of the DAR Global Survey 2022. So, some takeaway points. We know that Ramadan education, there is hypoglycemia risk is high for those who did not receive education. More efforts is higher in those who did not receive education. More efforts to improve proportion of those educated is needed. Ramadan-focused education remains essential to prepare for safer fasting before we celebrate Ramadan Mubarak. So the credits to, of course, Prof. Hassani is essential in getting the survey done and collaborating with all the various groups, the global study team, global scientific officer, and of course, all the various researchers and colleagues who had participated and contributed to this study to make this a successful data collection. And here I thank you, and may the Ramadan 2024 be full of blessings for you. So I hand back over to the panel.